We have a really great presentation today, so thank you all for being here and joining us. A couple quick housekeeping items. We are going to be recording this. We have everybody's mics and cameras off, but you'll be able to put your questions in the chat throughout. Also, please, if you are so inclined to do so, let us know who you are, where you're from, how you heard about us. You can put that in the chat as well. And I think that is it. So we just want to introduce our speaker, Evan Shalom. He is from Bucks County, the Director of ID Services over there. He's going to give us an overview about their developmental services and kind of navigating that system. So thank you so much, Evan, for being here. And I will turn it over to you.
Thanks, Mary Ellen. Like Mary Ellen said, please feel free to use the chat, and she's going to be monitoring it. So if there's any questions, we'll kind of pause where we're at and try to go over it. And some things might be like addressed in later slides, and I'll say we'll get back to it. Or, if you want to wait till the end, that's fine too. Like she said, my name is Evan Salom. I work for Bucks County government in the behavioral health and developmental programs office. And I work with our team to oversee services on behalf of what we call ODP, which is the Office of Developmental Programs at the state level. Our services are available for individuals with intellectual disabilities, autism, medically complex children, and children with a developmental disability. Services are kind of wide ranging, so we'll cover them, but there are some examples here on the slide: residential, respite, home and community support, employment, day programs, transportation, all that good stuff. I say this with the caveat that, our services are available for everyone. It's a long-term service. Anyone who meets the eligibility criteria, no matter their age. So we serve individuals from birth until the end of their lives. The only way to get set up and access the services is to go through intake at our office. Here's our website below. There's a link in there, and I will be sharing the slides. They'll be sent out in an email afterwards. And then also at the end of the presentation, there's a QR code that you can scan that takes you to our website. But again, intake, two ways to initiate an intake. Number one is to call us. There's the number on the screen. There is typically a person answering the phone during business hours. We also have a voicemail that we check. And then you can also email us as well at the intake or at the intake email list on the slide. Our volume is very high and our intake team is not very big, so the intake process can take quite a while. It's a lot of hurry up and wait, which can be very frustrating to families, but it can, typically takes, 4 to 8 months to get through our intake process. Once an intake is initiated, either by calling us or email, we send a checklist of the information that is needed to complete intake. The checklists are pretty long, but basically we need 4 things to get through intake. We need birth certificate, social security card, medical assistance cards, or any insurance cards, and then we need some type of document that shows that they have one of the qualifying diagnoses. Typically, the vast majority of our folks that are coming in either have an intellectual disability or an autism diagnosis. And again, stop me at any time with any questions, but the eligibility for both intellectual disability and autism, it needs to be a qualifying diagnosis made by a qualified professional. So a qualified professional is typically a licensed psychologist or a physician, like a neurologist can make it, any type of medical professional. It needs to be grounded in a diagnostic tool. So for intellectual disability, that is typically an IQ test with simultaneous adaptive functioning measure. And again, it needs to be signed by the professional who administers the IQ test, and the IQ test needs to be administered by a licensed psychologist who's qualified to administer that and interpret the results. For autism, there are a bunch of different assessments that can be done. There's like some rating scales. There is an actual assessment. Most of our individuals that are coming through through our intake are children, teenagers and younger. So a lot of the times we use the school reevaluations to determine eligibility, but we also do work with private psychologists and clinic to do assessments. Um, there has to be one of the eligibility criteria is that the onset of the diagnosis needs to be present prior to the age of 22. So we do frequently get adults coming through our intake, and obviously they're older than 22. But the psychologist who's making the diagnosis needs to, in that scenario, needs to make some type of statement that this is a lifelong condition, or that the diagnosis was present during what we call the developmental period, prior to the age of 22. For some things that are more developmental in nature, like Down syndrome, it's pretty easy to make that leap. It's a genetic condition, but sometimes it's a little bit harder to find, the cause of the disability. So we are looking for language as to like how they came to the conclusion that the diagnosis was present prior to the age of 22. If the individual is already an adult. If they're under 21, then it's inherent that it was present during the developmental period because they are still in the developmental period. I'm going to pause for a second and see if there's any questions in the chat.
Not yet, Evan, but I'll keep you posted.
All right. If there's any questions, fire them away. I typically spend a good amount of time talking about evals. All right. So after we get all the paperwork that shows that they have an intellectual disability or autism, and we get all the demographic information that I talked about, we make a determination, either eligible or ineligible. If they're ineligible, it means that we, for some reason, cannot justify that they have the appropriate diagnosis, or that the adaptive functioning measures are too high. But if a person is eligible, what we do is we assign them to a supports coordinator. A supports coordinator is pretty much like a case manager. That's what we call them in our ODP language. They help navigate the system. They make sure that the individual is healthy and safe, connect to services and other local resources. And it's very important that they attend IEP meetings during transition years. I think I mentioned this earlier, but it's pretty important to say that our services are considered long-term. A lot of like the mental health services are more short-term, where it's like, what is your identified goal? We're going to help you meet your identified goal, and then we'll discharge, or if you've met the criteria. That is not how our services work. If a person meets their goals, that's great. We celebrate, and then we pick a new goal so that we can continue to grow and develop and acquire new skills. One of the primary functions of the supports coordinator is developing what we call the ISP, or the individual support plan. It's similar to an IEP, but it's not just focused on the education setting. It goes over the individual's preferences, what they like, what they don't like, what their needs for support are, what makes sense in their life, and then it goes over their medical information, what meds they're on, what doctors they see. It goes over their health and safety needs. It goes over their functional information, financial information, and their goals. These have to be updated at least annually, but they can be updated more often. However often the SCs have time to update them.
Hi, Evan. We do have a question.
Sure.
Who can you contact if you don't have a supports coordinator assigned yet, but submitted all the paperwork?
So if you submitted all the paperwork, you should be okay. Depends where they are. So once we have all the paperwork, we assign them to one of the intake coordinators at our office. And so like we have a person who's collecting all the paperwork. And then once the packet is complete, they assign the information, the packet to one of our intake coordinators. And there's typically like a 2 to 4 month wait before the intake coordinators get to review the packet to make sure everything is there. So, but they should have received an email saying like, hey, your packet is complete. You've been assigned an intake coordinator. And in that scenario, I would contact the intake coordinator and see where they are in the line to be reviewed. I hope that answered the question.
Great, thank you. If there's any follow-up questions, just put them in the chat.
Yeah, once the intake worker determines that they're eligible, they'll get a letter saying you've been determined eligible, and the intake worker will contact them and say like, and they'll set up what we call a registration meeting. It's going over lots and lots of paperwork, and one of the pieces of paperwork is selecting a supports coordination organization.
Amanda, we can see if we can take you off of mute if that's helpful too. Give me 1 second.
While you're doing that,
Yeah, sorry.
I'm
Thank you. So my son was he was underage, like probably 15 when I started the paperwork.
Mhm.
Um and submitted everything. I did have someone come to my house, but the problem is he's we haven't been assigned anything after that. So I guess do I just keep calling the office to see like where he just turned 18 this year, so I know we have a few years. But to attend his IEP meetings, if that's supposed to be happening, we don't have someone assigned to us yet. If they just keep saying they haven't reviewed the paperwork yet,
okay. They just keep saying they haven't reviewed it yet. Yeah,
even though they have everything.
and it takes us a long time to do everything. It's a lot of hurry up and wait. I would ask them like where in line he is, kind of like how many people to be reviewed for him.
Okay. All
And
right.
that and
I'll do that because it's been a few years. So when you
few
said like
years.
4 to 6 months, I was kind of like, oh, well, or 8 months. I was like, well, that's great. So yeah, it's been a few years since we submitted everything.
Yeah, there's no way that you're still waiting, that he's in line anywhere. So I would you can contact me if you want to. My email address will be at the end, and I'll give you a full update about where everything is.
I appreciate you very much.
Yep. We good to move forward?
Yeah, we're good.
All right. Okay, so if you're vaguely familiar with the system, you might have heard the big money word is waiver. I need to register for a waiver. I need a waiver. And you might be asking, what is a waiver? It's like the number one question I get. Waiver is funding for services. If you get a waiver, it means that you have funding available to receive services. It's important to note that all of the waiver services are Medicaid funding, so an individual has to be enrolled in Medicaid to be enrolled in a waiver. They do not need to be enrolled in Medicaid to receive supports coordination or to be registered with our office, but to get anything beyond a case manager, they 100% need to have Medicaid. And Medicaid eligibility is its own like hour-long discussion. So if you have any questions about Medicaid or Medicaid eligibility, you can try to fire them away here. We can address that maybe at the end, but just I like to note that. And if anyone's curious why we call it a waiver, it's because it all goes back to like the Pennhurst days when all services for people with disabilities were provided in institutions. And what a waiver is that an individual has been determined eligible to receive services in an institution, and they are waiving their right to go to an institution and instead are choosing to receive their services in a community setting. Very dated term, but that's actually what it means. Okay, so the waiver is what we call a limited capacity program. There are a defined number of waiver slots, and we cannot physically enroll anyone over our assigned number of slots. So if there are like 1,500 waivers in Bucks County and all of them are filled, we cannot enroll anyone until we have an opening. And we'll talk more about like the specific waivers on the next slide. But there is a waiting list for waiver. It's called PUNS. It's that mouthful of an acronym there. It is based on the severity of the need, not chronologically when a person is placed on the list. So we could have a 10-year-old that is placed on the PUNS list, but because they're 10 and they're getting services through the school district and through, there's a lot of services available to children through Medicaid, like health insurance, that are not available to adults. So, a 10-year-old could be on the PUNS list, but we could get a 25-year-old coming through intake. They're just going to jump right ahead of someone, the 10-year-old, just based on the severity of their need and the time in which they need it. The PUNS is completed with the family by the supports coordinator, so they have to go through intake. The supports coordinator needs to develop an ISP before it can be simultaneously to the ISP development, but they have to be through intake and determined eligible before the PUNS can be completed. Any questions before I move on? I'm going to take that as a no.
No, there's none in the chat right now.
Wonderful. Okay, so the waiver is a tiered program. The services available through each tier are exactly the same. The only difference is the amount of funding assigned to each tier. So it's kind of like a small, medium, and large situation where we have what we call the PFDS waiver, Person and Family Directed Supports. That is our lowest tier. It has a $47,000 annual cap. We have our community living waiver. That is our middle tier. It has a $97,000 annual cap, meaning that an individual can receive the services that they need up to $97,000 per year. And then we have the consolidated waiver. That's the one that everyone wants. And I get lots of calls about. That has no annual cap. The individual can receive the services that they need without being burdened by an annual cap. It provides services and supports to the individuals with the greatest needs. So to kind of conceptualize what $47,000 and $97,000 can get, I like to kind of break it down into part-time, full-time, all the time. So PFDS, $47,000 gets you part-time support. It's like a 15 to 20 hours a week kind of deal. It's job coaching. It might be a part-time day program or an aide, and we'll talk about all that stuff, all the actual services in a few slides. $97,000 is about 40 hours a week of services, whatever that might look like, a job coach, day program, in-home services. And then the consolidated waiver is for someone who truly needs 24/7 care, either in their home or in a residential program. And our availability for each of the waiver is, I like to say, green, yellow, and red. For the $47,000 lowest tier, we typically have some slots available for adults or kids coming out of who are graduating from school at 21 or 22 for whatever they might need that can fit under $47,000. It's a job coach, it's transportation, it's maybe a part-time day program. We're pretty good at getting individuals enrolled into this waiver. We usually have spots for all the adults that are eligible and need it and want it. For the $97,000 cap, the state has been okay at giving us a limited number of slots each year, although I'm We haven't gotten any in a while. Our availability is pretty limited. For the kids that are coming out of school, it's really like reserved for the kids that have no ability to be unsupervised at any point. Their parents both work out of the home or they have a single caregiver and they really need like full-time care during the day. Um, Again, like we understand that more people need this middle tier than we have availability for, and it's really hard for us to prioritize. We'll often put people in the lowest tier knowing that the middle tier is more appropriate to meet their needs, but we are working with what we've got and doing the best with what we've got, which is limited. And then the consolidated waiver is the red light. We have a very limited amount. The state very rarely gives us new slots. They gave us some, I think, like a year and a half ago, and that was the first time they gave us, and it was only a handful. And that was the first time they had given us any in like almost a decade. Um, Typically, the way we get new slots for the consolidated waiver, the only way, is someone who's in the waiver leaves the waiver. And like I said a couple times before, we serve people for their entire lives. So the number one, by a lot, way we get a new consolidated waiver slot is that someone who's in the waiver passes away. Second would be if they move into a nursing home, you can't have waiver and be in a nursing home. And third would be if they move out of state. But again, the last two are pretty rare compared to the passing. We have an exact number of consolidated waiver slots. I don't keep extra ones in a drawer in my desk. We cannot enroll beyond what we've been assigned, and we are constantly making extremely tough decisions about who gets the one slot that we have based on the number of crisis situations that we have going on at any 1 minute. So it is extremely difficult for us to make these decisions and manage this program. It is by far the hardest part of my job.
Evan,
There's usually questions here. Yep.
yeah, I was like, we do have a question. It is, should Pennsylvania's Office of Vocational Rehabilitation, OVR, intervene even if the adult is not enrolled in Medicaid?
So we work pretty closely with OVR and we defer to them. So anyone who needs services the waiver can provide employment supports. But we don't provide employment supports to anyone until they have gone through the OVR process. And yeah, their eligibility criteria is much looser than ours. So even if a person doesn't have Medicaid, they can receive services through OVR if they have a disability. So yeah, we defer to them always for services that they offer. Does that answer the question? I'm going to take
Yep,
silence
it
as a
says
yes.
yes. Yep,
All right,
yes, thanks.
great.
Thanks, Jaya.
All right. Any other questions besides like the gloom and doom that I always provide on this slide? All right.
Not yet. Nope, we'll keep you posted.
Okay, so I have a few examples of like what services might look like in each waiver, so we can go through them. And I'm not going to read the slide, but in general, the PFDS waiver is perfect for someone who's pretty independent, is probably working in some capacity, can do some things on their own, or maybe they have a lot of family support. But in general, we're looking at it can provide a job coach, it can provide Uber, it can provide support staff, all of those things available. And in this situation, it's, about 15 hours a week, mostly provided by the support staff. And I'll add that there is, for people receiving job coaching, like employment services, there's an extra $15,000 allocated to them to receive employment services beyond the $47,000 cap. We want people to work. That is our primary goal, always. Moving on to example 2. And yes, I did use Phillies players' names for this. So in this example, a person attends a day program full time because the parents both work out of the home. There's transportation, round trip transportation each way, and there's a natural support, the aunt, that gives the parents a break. And I do like to mention here that in our program, family members can be hired as paid caregivers. There are pretty strict limits on it. Everyone has to work within the waiver budget, and a lot of these services are intended to support families. So kind of paying families to provide the care is not it's not the intended purpose of the services, but we also realize that sometimes, like we have family members all the time that leave their career to provide care for their loved ones because there's just not stability. Like they can't find staff to provide the care needed, and they're calling out all the time and missing work and at risk of losing their job. And it's just that ends up being the best solution for everyone. So we understand that happens a good bit. But I'm going to carry on to slide our last example. In this situation, we have a 50-year-old who was living with her parents, but they're not able to care for her anymore. She moves into a community home run by an agency. There's 24/7 staff. They prepare all the meals, they do the meds, they plan the activities, they do the cleaning, they schedule the medical appointments. The individual is responsible for paying a portion of their income, whether that's SSI, SSDI, or wages through employment. They have to pay room and board to the agency. The agencies can also manage their money and ensure that they have spending money for whatever they're interested in, like activities or just things they want, vacation, whatever. But living in a residential setting like this does require the consolidated waiver, which can be the biggest barrier to individuals moving out of their homes. I get a lot of calls from families, their kid is in their early 20s and they see their siblings moving out and they're like, oh, wouldn't it be amazing if, they could live with one or two friends with, just a lot of support in the home to make sure that everything is taken care of and that they're safe, but that they feel more independent, that they're not living with mom and dad anymore. And I agree, that would be wonderful. But unfortunately, group homes cost somewhere between $200,000 and $500,000, and we just don't have the funds to support that. So that's kind of where we're at, and it's kind of where we're going to be for the foreseeable future. I got 2 slides left. This one is all the waiver eligible services. So if it's on this list, it could potentially be covered by the waiver. If it's not on this list, it definitely cannot be covered by the waiver. Waiver can't pay for things like food. It can't pay for rent. It is intended to be services. The waiver covers services only. There are a lot of rules with each service. A lot of them, like the therapies, music, art, equine, but also PT, OT, and speech, require denials from insurance, which can be quite a trick. It covers nursing if an individual needs nursing level of care. CPS or community participation support is what we call our day programs. Education support is what can provide funding for college and university. We can do home adaptations. We can do vehicle adaptations. Transportation is a big one. It can be either BCT, it can be Uber or Lyft, it can be reimbursing mileage. Our most popular service is called in-home and community support. It's exactly what it sounds like. It's basically a one-to-one aid providing care either in the home or out in the community, working on desired goals, whatever that might be, working on independent living skills in the home or out of the home, learning how to take public transportation. Exercising is a big one, food shopping, cooking, cleaning, whatever that might be. I'm going to pause here and see if we have any questions.
I don't see any in the chat, but maybe we can give it another minute.
Oh, I can just go to the, I like to leave this slide up for a little bit,
Yeah.
but I will say if there's any questions, there's the QR code to our website. There's my email address, and then Sean and I usually do this. One of us, we both do these presentations a lot, so his contact information is on here as well. If you want to reach out to Sean, but my info is on there as well.
I think this is great. This is a ton of information. I remember seeing you, I think it was at a school presentation about a year ago, and it was like mental note, we got to have Evan come in and do Wellness Wednesday. Because it's just a lot. And the way you explain it is just so relatable and but also thorough. So we really appreciate you being here today.
Yeah, of course. Thank you. It's the system, I like to refer to it as like a subway system, but there is no map. So you're just kind of figuring it out as you go. And you might figure out like one little piece of it and then but not know the rest of it. So kind of putting all the pieces together is very, very challenging, especially when they're constantly changing.
Yeah, yeah, absolutely. Yeah, we'll give it another minute. Anybody else have any questions or if you want to come off mute, let us know and we can have a bit of a dialogue.
I can give like a 2 sentence summary. If all of this was extremely overwhelming, I'll say the biggest takeaways are that our services are for people with intellectual disabilities and autism, mostly for when they leave the school system at age 21 or 22. The only way to get these services is by registering with our office. We are the only substantial support for people with ID and autism after they leave school. A lot of parents think, the school is required to provide this care up through 21, and then at 21 or 22, you know, they'll figure it out for me. Everything is going to get handed to me, and that is just not true. The bus will stop coming. It will stop taking them to school when they turn 22, and in order to continue receiving some type of service that looks somewhat like school, the only thing to do is to register with our office. So it's very important. And there is
Yeah.
no minimum age that can be done. Like I said earlier, the intake process is cumbersome. We have a lot of people going through intake and people slip through the cracks frequently. So it's important to advocate, to continue to contact us to make sure that we're not missing anything, that the person is ready to be reviewed, and that they can keep moving forward. Doing it at 20 is too late. Not that you shouldn't do it at 20. Better late is better than never. But I always recommend that between 16 and 18 is the perfect time to go through our intake. Although if you're a little anxious and want to get it done earlier, we have people that are 7, 8, 9 years old going through our intake all the time. We even have 3, 4, and 5-year-olds going through intake. It's totally okay.
That's
That
great.
was
That's helpful.
way more than 2 sentences, but sorry.
No, that's helpful. We have a couple questions and a comment. The comment is, thank you. These examples are especially helpful. I agree. So thanks, Nancy. And then first question, in Montgomery County, I believe children are told to start the process around 14 years old. Is that the same for Bucks? But it sounds like no, they can start at any age.
So yeah, they can start at any age. And I would say that 14 is kind of like that's like the statewide recommended age of transition services should begin. So yes.
Okay. And then next question is similar services available in other PA counties?
Yeah, so this is it's a statewide program, or I should say Commonwealth-wide program. There's an Evan in every single county in Pennsylvania, and the waivers are transferable between counties. So if a person has a waiver and they decide that they want to move to beautiful Erie, Pennsylvania, their waiver would go with them. But if they decide they want to move right across the bridge to New Jersey, they would have to close all the way, their Medicaid would have to close. They would have to start brand new from scratch. So anywhere in PA, the waiver is good. Even if they're open with just supports coordination, we can transfer anywhere in Pennsylvania. All the services are similar. It's going to be different providers, but they're similar. Uh, only to Pennsylvania. Every single state has a system like this, but the systems don't talk to each other and they don't transfer across state lines.
Okay, that's helpful. I will, as long as we're on real quick, I will give a quick shout out to for Woods Integrated Healthcare. If anybody's looking for testing, some of the stuff that Evan was talking about earlier on in the presentation, we're able to do some of that here. So I'll put my info in the chat. Feel free to reach out to myself and I can get you the information on that. I think that's it. So Evan, anything else?
No, I think we got it all.
All right. Well, thank you. Oh, wait, we have one more. What if somebody is moving from New Jersey to PA? Sounds like
Yeah, the
they'd have to
the
start over.
the state moves are really rough. It happens all the time. We can't actually open anyone until they are a resident of our county. So if they're moving from New Jersey, they can't even start the process, which could take up to a year to even get registered, let alone access services until they are physically living here in Pennsylvania, in Bucks County.
Okay,
I wish
great.
that the system worked better than that and that, we could transfer from any state, but it's very siloed.
Yeah. Okay, great. Lots of thank yous, lots of appreciation in the chat. For everybody else, yes, I have my contact info in there, and then our Woods Healthcare website. Evan's contact info is up here. I think we mentioned at the beginning we'll be sending out the slides for Evan. We'll be sending these out to everybody that registered, so you guys can reference back to this. And I think we're good. So thank you again, Evan. Really appreciate all this information and for being here. Um, and until next month, keep your eyes peeled for Wellness Wednesday in March. So thanks again, everybody. All right, take care. Bye-bye.
Bye.